Hi, my name is Frank Sharp. I'm a vascular surgeon at Jersey Coast Vascular Institute at Ocean Medical Center. Peripheral arterial disease, or PAD, is essentially hardening of the arteries in the arteries that bring blood to your legs. The process of atherosclerosis, or hardening of the arteries, is a slow, gradual process. So the normal artery is essentially a pipe bringing blood to any part of the body, in this case the legs. And if you have underlying conditions such as diabetes and blood pressure and cholesterol issues, or you smoke, over many, many years, those pipes, those arteries become damaged. The inner lining and the middle layer of the vessel wall becomes damaged, and the response to that injury or damage is the formation of plaque. And if the pipe is narrowed, you just can't get any more flow through it, so the muscle tires. Many people have PAD, but I would say a very large group of patients have it and don't even know it because they're either not very active or because the disease is very mild. Another very large group of patients have narrowing in these arteries, and they'll only know it if they do substantial walking. A very small group, thankfully, are the group that have such severe narrowing in the arteries or blockage in the arteries that they're getting very little blood flow to their feet. And they may have wounds in their feet that won't heal. They may even have pain at rest in their feet. So when they're lying in bed at night, flat in bed, there's such little blood flow that gets to the feet that their feet hurt. Most patients, probably 80% or more, do not really need an aggressive interventional procedure. The majority of patients diagnosed with PAD can be treated by lifestyle modification, getting those risk factors under control, including cessation of tobacco, the right medicines for blood pressure and cholesterol and diabetes if you have those conditions. Exercise is very important, weight reduction. There are some medications that can help people walk better. Exercise is probably unsurpassed in terms of its effect on PAD. The high-risk group of patients nowadays have many more options that are minimally invasive. Patients that can come in under local anesthesia, have a procedure done, and go home the same day and have the blood flow improve dramatically. I believe that the advantage to coming to an institute such as ours is that we provide the full spectrum of care. So we provide the medical care and diagnosis, we provide the interventional procedures, which are minimally invasive, and then, if necessary, we can provide the surgical care, which is more involved. We have a team approach, so we're all trained the same way, and one of us can provide any of the service lines that we provide, which include treatment of aneurysms and dialysis access and veins, varicose veins and venous disease, carotid artery problems, PAD, and then we follow these patients indefinitely. So most of my patients have been my patients for many, many years.